Hi, welcome to Scottish National Network, Clare. For the audience out there today, we're back again. So I am really pleased to see and be able to tell you that I'm talking to Clare Hardie, the Chief Operating Officer from Liverscan in Edinburgh. A real topic of conversation here at the moment, particularly with how health issues are with the Scottish Government. But before we get into that and I start asking Clare all about her opinions about what's not happening and what is happening, Clare, welcome. I think it'd be really beneficial for you to be able to tell the folks out there who you are, what the company does and how best they can contact you, please.
Perfect. Well, thanks so much for having me on the podcast to start with. I think it's a great opportunity to just share who we are. So our business is called Liverscan. We are a small startup company. We opened our doors in July 2023. We are Scotland's first accessible liver screening service. So we use what's called a FibroScan device, which is the gold standard in liver health, to do examinations, and it provides two measurements. So one tells you the percentage of fat on your liver, and the other one tells people if they've got any scar tissue or liver stiffness, or fibrosis is otherwise known. So with liver health, it generally has no symptoms until the point it's too late. Hence why we thought a screening service is the optimal kind of way forward. So I think a lot needs to be done in terms of the preventative sector in healthcare. So here we are. This is what we do. We're based in the city centre of Edinburgh. So you can contact us directly through our website, which is www.liverscangroup.co.uk. And it's got a contact form on there, whether it's individual, whether it's corporate companies. There's both sectors and we deal with both entities. And our aim is really to improve liver health across Scotland. There's a big issue with fatty liver disease. So it's estimated around 25% of the adult population are living with fatty liver disease. So fatty liver disease is the first stage of any liver disease. It's where your liver cells become clogged with fat cells and it can no longer function properly. In Scotland, obviously, we also have alcoholic liver disease. So in the UK as a whole, 50% is due to alcohol, but in Scotland, we're out there at 60% for alcoholic liver disease. So both issues are a huge crisis coming down the line. And without services where you're going to screen for these liver health, by the time people know that they have a problem, it's going to be too late to do anything with your liver. But your liver does have a very good regenerative power. So if you catch it before the liver's 70% damage, you've got the potential to fully reverse it just through lifestyle changes. Mm-hmm. So that's who we are, where we are, and what we do.
Are you finding that there's any particular age category that would be best suited, or how can, for instance, symptoms become noticed to an individual?
So liver disease isn't age related at all. It's completely lifestyle related. So for example, 2 weeks ago, we had a guy in the clinic who was 95, who had some of the best liver results I've seen in the last 2 years. On the flip side, I also scanned a guy who was 22 and who had extremely fatty. So the fatty liver scale goes up to 400. Mm-hmm. This particular individual sat above 380 at age 22. So age is irrelevant, all to do with your lifestyle. So diet, exercise and alcohol. And all three of those in combination can either provide for the best liver health or the worst liver health. In terms of symptoms, some people get a little bit of pain on the right-hand side where your liver sits, generally due to inflammation in the liver tissues, because obviously under your rib cage, there's only a certain amount of space there, so if any of your organs are inflamed. But most people don't get anything until they potentially have jaundice, by which point you can't change it with lifestyle. Your only option is a liver transplant.
So we're in February 2025 at the moment, and what's happened over the last couple of days has been a phenomenal media outlet about the fact that liver scanning is not there, particularly not in Scotland. There's a complete difference between the way we operate in Scotland as opposed to England. Could you maybe elaborate on that for us and what you would like to be able to see moving forward? Thanks.
Sure. So in England, they follow the NICE guidelines. So they introduced a new theme where they're going to put 100 of these devices I was talking about called FibroScans across community centres in England with the aim of screening. In Scotland, we don't really have community health centres the same as they do in England, and we have nothing from our Parliament in terms of forward planning with liver screening. despite the fact it being the only major disease that's increasing in rates. Everything else is on the decrease. And when you think about all the prevention that they do in terms of like cancer screening, it doesn't seem right that you wouldn't screen for the liver, especially when it has no symptoms. So we would like to see the government put more initiatives into preventative health screening, because we know that that forms a very minute part of the budget. And for example, obesity costs the government billions of pounds every year, and so does type 2 diabetics. And both of those categories are at a 70% risk of having fatty liver, because it's all connected in your kind of metabolic system. So if we could reverse only 1% of those people, you're still going to save the government millions. And, all the complications that they're going to have further down the line from those other comorbidities would potentially reduce as well. So there needs to be, I think, a flip in the healthcare system. So as much as the NHS does a great service, it is at the point where it's at breaking point. It can't cope if it's going to continue the way it is. It would be nice to see more integration between the public and the private sector, because at the moment there's a real standoff. And we've tried to say, like, we know that they do have FibroScans in the NHS in Scotland, but a lot of them are used in secondary care.
Okay.
We need it to flip to the primary care side. Yeah. And we know that there's a wait list, and we've put our hands up. We've spoke to the government. Or as much as we can, and said, we'd love to work with the NHS. We'd love to take some backlog of patients. We know what rate the NHS would essentially charge for a FibroScan, and the local kind of NHS boards could pay us that rate instead of, them scanning there. They could refer patients to us. We could do it a day a week, 2 days a week, whatever it may be, to help reduce those wait lists. But at the moment, it's just a point blank. It's so hard to get through to the right influencer within the government, the right connections, trying to get through all those barriers. It's almost like Mission Impossible.
So the assumption is, because of the fact the media covers UK-wide, most people up here in Scotland would automatically assume that the same system that's applied in Scotland is in England, that you can go outside private but through the NHS. That's not happening. And for the reasons that you're saying, it's really a barrier to entry, which is really not fair. So
there's very unclear pathways, I would say, into entry to work between the two sectors, and it's very difficult. They make it almost impossible, whereas there could be a much more streamlined way where, the public and the private sector could work in harmony to achieve the same goals and end up in a better place for both sectors, rather than them both work in completely opposite directions for the same outcome.
So talking sort of more generic about the National Health Service, would you like to see a more interactive public and private partnership based on, this is where we need to be, this is where we are going, and this is how any problems can be resolved by having a better partnership?
Yeah, 100%, because it happens elsewhere in the country. So, for example, in NHS England, they do have partnerships between the public and private sector, where I know, and a good example is an MRI scan where they had a backlog of MRIs. So they outsourced some of the backlog to private MRI screening services. At the end of the day, we're all there to benefit the patients. And the patients don't have the wait list. They've got less of a wait list. They get seen quicker. They can then get triaged into their different sectors quicker to see other specialists or whatever their care may be after that point. And it's the same with liver health. And the fact that if liver health is caught early, you can do something about it.
Mm-hmm.
You can't afford for these people to be on a wait list for 6 months, a year, 2 years, because in that time, their liver health's not getting any better because they don't know about it or they don't know what to do to improve it.
Mm-hmm. I mean, that again, most people think that the Scots are alcoholics or not. It's the minority that cause it for the majority that cause the issues, but the issues are pretty drastic when something happens.
Even if you take alcohol out, as I said, it's lifestyle, so diet and exercise. Like if you just look at the number of people that are in the obese category, like that rate is also going exponentially up.
Mm-hmm.
And those people are at 70% risk of having fatty livers. So they might never have touched a drink in their life. It's purely through diet and exercise that they've got to where they are. And they can still end up with liver cirrhosis just from poor diet.
Yeah.
But again, liver's got a bad connotation with alcohol, whereas we need to remove that and introduce the fact that it's it's a three sector way. It's diet, exercise and alcohol.
Do you think it's because, again, I'm going back to what I touched on before, folk tend to think that Scottish people we're all drinkers, but we're not. We are not,
Yes and no. I think people know themselves that they're not. And I think there's a definite generational shift. So in people, say, like a decade younger than myself, like I remember when I was at uni, the thing was to go out and have a drink. But now everybody at uni, the thing is join a sports club or go out for a run with your friends. So there's definitely a shift generational wise with the connotations with alcohol. And
so it's a broad church, basically. You just never know how the symptoms have had occurred. So all I can suggest to you, and I would hope that you would take this up, the Scottish National Network, we are opening up our monthly meetings to members on a Tuesday morning to join us in Glasgow at the Bank of Scotland in Argyle Street, just to try to put together some sort of concerns we have about the way things are going across Scotland. Obviously, this affects your business because of the fact that you're not getting funding necessary in order to be able to increase your business. You are an entrepreneur in terms of what you do.
I think if we made it easier for especially like small businesses, and maybe I'm thinking more of a health, because that's where my background is, healthcare. But if the government could introduce things like, if you're in a preventative healthcare setting, could there be a tax break because you're helping the population, you're helping the kind of health of the population, and you're hopefully going to prevent healthcare complications down the future. So could they introduce some sort of tax benefit where, because you're in that sector, help us out, and help us to make those connections and help us to make it easier to integrate between sectors?
Well, we can but try. And as you mentioned before, you've tried as often as you can as well, but we only just start getting the message out. You just need to make people aware. So I'm just going to change the tactic just slightly just now, and I know you're coming along to one of our first of our meetings this year in Edinburgh for the network, where we're hopefully having a wide, diverse range of businesses coming along. And I hope you take the opportunity to let folk know exactly what you're doing, because I think it's really interesting. As I say, you've come at the right point in time in terms of the media coverage for everything that's going out there. This is the Scottish National Network's podcast. I know you've just become a member yourself, but moving forward, where could you see the network perhaps helping you look at the issues that you've already discussed this afternoon?
I think if we take the government bit aside, I think we've covered that in some good detail, but I think corporate wellness is where we would quite like to go, and where we hope that the Scottish National Network can kind of benefit us. So I'm signed up to the event in Edinburgh, as you mentioned. I'm really excited at the fact that you've now going to start doing regular meetings in Edinburgh as well as Glasgow, which should make it easier for me with my limited time in between my clinic appointments to nip up, do a couple of hours at the Edinburgh sector. So for example, we just done our first big corporate wellness day where our kit is portable. So I travelled to London for this one as a company reached out, and they have a wellness week every year for their staff. And this year's theme was called Know Your Numbers. So they had another healthcare provider in who was doing kind of like blood tests, cholesterol levels, diabetes screening, and then they had us doing the liver screens. So I scanned 30 people from that company in the one day, gave them all the results for the fibre scanner instant, gave them the lifestyle advice. I'd made a little nice video for them so they can go away, reflect on their own scores, watch the video, see how to improve their liver scores. But doing something like that in Scotland and more kind of locally, whether it be Edinburgh, Glasgow, Aberdeen, as I said, our machine's portable. So the connections through the Scottish National Network should hopefully help us achieve that. And corporate health and wellness is also like the big in thing, and how can you improve your staff retention? Can you give them extra health benefits? How can you improve the fact that they might not be off work long term or future? So introducing something like a liver screen as part of the corporate wellness. I'm
listening to you, and also I'm thinking through my mind the folk that I can introduce you to, just because of the fact they have come to the network you've perhaps missed because you've not been part of the network long enough to be able to know them. And I'm just thinking, I'm not going to say just now who they are because that's not fair, but I do know quite a few people who I think from the corporate world would really would hope to think that they would jump at the opportunity for doing exactly what you've said.
Amazing. Or even to get some, like we also do the individual sites, just to get individuals who are interested. They come, they spread the word through the network, through their own connections as well.
Yeah. Fantastic. I don't think that what you've said is something that anybody can ignore. I'm sitting here thinking, a woman of a certain age. I should be looking at X, Y, and Z. And I'm thinking to myself, is it preventative or am I past it? But no, you just never know. You just cannot take anything for granted these days because you just never know what's round the corner.
Exactly. And I think, one of these screening things, it's like a snapshot in time. So if you know that your liver health is good, it's not an excuse to maybe continue the way you are, but you know that it's good at this point, so you want to keep your liver healthy. Whereas if you come and you don't get particularly good scores, you get advice to know how to improve it or what to do as the next steps. And you can come back, you can see changes in liver health really quickly. So people can reverse, for example, a fatty liver in 3 to 6 months or less.
Okay.
So then they could come back for a second scan. You see the numbers improve. It gives you motivation to continue on that new healthy lifestyle.
Okay. Well, listen, Claire, it's been really lovely to speak to you, find out lots about the business. I can only wish you well. I hope we can help in lobbying to get the appropriate information that you need to be able to expand the business. And with that, folks, I'll say thank you very much for listening. And you've been listening to Claire from Liverscan, who you can find all the details out on the website. Thank you very much.
Thank you.